Some people may be surprised to learn that sepsis is the main cause of death in intensive care units. Can you explain first what sepsis is for those who don't know?
Well, sepsis is a condition when the body has an excessive immune and inflammatory response to an infection. This leads to damage to organs. It can, in the worst case, lead to multiple organ failure and death. And indeed, something like 11 million people a year globally die of sepsis. It accounts for 20% of world deaths every year.
And so for patients who do survive sepsis, are there long-term effects?
Indeed there are. I mean, many patients who have sepsis and have problems with their kidneys, for example, end up with chronic kidney disease. Many patients with sepsis have delirium, and they end up with mental problems following their recovery. So it has many long-term consequences.
You've been looking at vitamin C as a potential treatment for some time. What was it about vitamin C that you thought, well, this might be worth looking at?
We had been studying the changes in the kidney and in the brain during sepsis and found that there were big drops in the oxygen levels during sepsis. And we hypothesized that if we gave compounds that are called antioxidants, that this would help cure this problem and perhaps prevent the damage to the organs. And one antioxidant is vitamin C. There were some early clinical trials looking at low doses of this, which had shown some benefit. There were also other trials giving very high doses to patients with cancer and burns, but these very high doses hadn't been tried in patients who were critically ill. So that was the spur for us to try this in an animal model of sepsis, and the results that we achieved were quite remarkable. Severe cases of sepsis were completely resolved within about 3 hours of treatment.
I understand that this treatment was trialled as a compassionate case on a COVID patient in Melbourne last year.
Yes, that's right. We've had a long-term collaboration with Professor Ronaldo Blomo at the Austin Hospital in Melbourne, and we informed him of our findings. He came over and saw one of our experiments and was amazed actually at the incredible turnaround we got when we gave this what we call a megadose of vitamin C. And he gave it to a COVID patient he had who was critically ill and saw very similar responses to those that we saw in our experimental model.
And so now this is going to be trialled more widely on patients. When you say a megadose of vitamin C, just how big are we talking?
Well, in our animal experiments, we've given 130 grams. So this is about 20 to 30 times the dose that's previously been given in sepsis. And in the trials that are starting in Melbourne, they're giving lower doses just to be cautious to start with, but the plan is to build up the dose as time goes on.
How many patients?
And these trials started in one hospital, and there are plans to start the trial in 2 more hospitals in Melbourne. So this is very exciting.
And how many patients do you hope to enrol, and how long do you expect it will take before you have some further data?
Well, I think we hope to enrol about 20 patients in each hospital, so it's probably going to take a year to get that number of suitable patients. And of course, they have to also have controls. So we have a proper placebo-controlled clinical trial. And I think if those prove that vitamin C has this effect, it will really have a remarkable impact on the treatment of patients worldwide.
Professor Clive May, great that you could talk about it with us. We'll have to talk to you again after the trial. Thank you.
Thank you very much for inviting me.